President Shavkat Mirziyoyev got acquainted with the presentation on the activities of new proposals of the Center for Healthcare Projects. In particular, the center has developed proposals to improve the primary healthcare and emergency medical care system, introduce state medical insurance, and streamline the procurement of medicines. The presentation comprehensively analyzes these areas. Over the past 7 years, the financing of the healthcare system has increased 6 times. Hospitals are being equipped with the modern equipment and new ones are being built. To bring medicine closer to the people, local screening examinations are being conducted. Analysis shows that only 30% of the population's requests in this area are solved at the primary level. Some diseases are treated using outdated methods. The range of tasks that nurses can perform is limited. In this regard, based on international requirements, treatment methods for 7 diseases that are most common today have been updated. Another 300 clinical protocols will be reviewed by the end of the year. Routine examinations and non-drug therapies for patients will be transferred from doctors to nurses. In polyclinics, the routing of the patients will be streamlined, which will reduce the waiting time in the queue for appointments. 3 years ago, a medical insurance system was introduced in Sirdarya as an experiment. It revealed many shortcomings in the sphere. Due to insufficient digitalization of medical institutions, the insurance system does not function properly. A lot of doctors' time is spent on filling in reports. In this regard, a task has been set to create a model of digitalization of the sphere in Tashkent. For this purpose, all institutions will be equipped with the new computers and technical means. The electronic polyclinics and electronic hospital systems will be launched by the end of the year. Following the fulfillment of these activities in 2024, the mechanisms of state medical insurance will be introduced in the capital. The system will be financed by the general taxes paid by citizens. No additional fees will be charged for the population. Within the framework of the health insurance, a guaranteed package of 3 medical services and medicines provided by the state will be introduced. A system will be organized for referring patients to specialists of narrow profile, to hospitals, to asylum and family doctors. Free medical services will be provided only if this procedure is observed. Medicines within the guaranteed package will be provided free of charge to the population through pharmacies on the basis of electronic prescription for the treatment of the most common diseases. During the analysis of the emergency medical aid system, it was noted that the main problem is related to the lack of sorting of requests by the severity of disease. In this regard, a decision was made to establish medical consultation of patients through ambulance call centers. This year in Tashkent and next year in other regions, a team of paramedics and pediatricians will be created. Employees of the system will be retrained as a consultant physicians, called triage operators and paramedics. Instructions were given to improve the list of medicines and medical devices produced on the basis of direct contracts, as well as the procurement process itself. The head of state emphasized the importance of preventing diseases and increasing people's sense of responsibility for their health through the wide promotion of healthy lifestyle ideas in society.